Hello and welcome to First Friday Fertility. I'm Dr. Perry, and today we're going to be doing fertility myths. So I have come up with all this crazy stuff from the internet that people share with each other and say, oh, this is going to be a factor, this is negative, this is bad, and really is irrelevant. And a lot of the treatments and the things that people talk about for how to help you get pregnant honestly has absolutely no effect. So we're going to debunk a lot of the nonsense from Dr. Google and show you how you can be more effective. There are so many crazy things that are out there on the internet. I put in the title for this. This may only be part one. I might do more in November, just from having only gotten through a few. There's so much that has to be fixed and corrected. So we'll dive in and go into some of the most common ones. So the first one that I hear all the time is the position matters. And you have all these people who are, have their hips up in the air and I'm just looking for, hey, Angel, how are you? Good to see you. Hey, Elsa. Hey, Cynthia. There are all these people who say, oh, you know what, I have to have these anti-gravity boots, or I have to have something where my hips are in the air for at least 10, 15 minutes. And by that time, hey, Brandy, then things will actually happen. That is complete craziness. Now think about it. Again, as a species, we didn't have pillows to help the hips, 10,000 years ago. The species didn't die out. The truth is, for the hips, sperm, when you have relations, find the uterus within 2 minutes and the tubes within 5 minutes. So if you had some perfect position, that might get it to the tubes in 4 minutes and 50 seconds instead of 5 minutes. But here's the thing. Sperm live for 72 hours. So if you have gotten it there 10 seconds early, honestly, you aren't really changing the odds. And so this is one of the crazy things. Hey, Nikki, how are you? Good to see you. There are all these, hey, Bryce, there are all these crazy nonsense things. And so really, if we were doing it wrong by we having to have a particular position, again, humans would be long gone. So don't worry about it. You don't have to get those anti-gravity boots, go full Batman, upside down, all that crazy stuff. The next one I hear sort of how people go about natural relations to try to conceive is saying that if you have sex a certain number of days before ovulation, that will influence the gender. And the philosophy is that the Y chromosome is unstable. We can joke all about men and how they're unstable in other ways, but the reality is X chromosome paired with an X chromosome, that's, more stable relative to the Y, which is a little more unstable. If you were to have sex sort of instantly at the moment of ovulation, you're more likely to get a boy because the Y sperm don't live as long relative to having, sex 5 days or 6 days or 7 days before ovulation, and that will be more likely to result in the girl. First, if you're going 5, 6, 7 days, you're more likely simply not to be pregnant. Sperm live for 72 hours, and so, if you're going that long, you're just going to miss the window, or again, it can happen, just more rare. The second thing is, that's not how the species work. And again, think about it. For all the pressures of primogeniture and having a boy that existed for millennia, if it really worked that way, someone would have figured it out and proven it. And the Sheddles method, which people talk about for timing the sperm to influence gender, it has not been meaningfully proven in any well-designed study to make a difference in whether you have a boy or a girl. There are things that can influence that. You can do PGD, PGS, all that type of stuff. But again, I would say if you're timing things to have a boy or a girl, at least 50% chance you're going to be right for how you did it. Okay. Hey, Ashley, how are you? Good to see you. I've got to throw in a few of the likes here for the comments and all that. Okay, next one, having sex after the basal body temperature chart rises. So I don't know if you're into basal body temperature charting or people who are. I hate it with a passion. Again, it's cool from a physiologic standpoint, but what you do is, again, you get up at the same time of the day every single day, and so 6 a.m. or whatever it is, and the first thing you do when you get up is you write down your temperature, and then if the temperature goes up, it means you've ovulated. First, I think that will drive people crazy. It won't tell you anything about fertility because it really is after you've already ovulated, so it won't help you with timing anything. And the other thing is, you're doing it to see if you're regular. Well, do you have regular cycles? Okay, then you're regular and probably ovulating. Are you not having regular cycles? Then you're probably not ovulating. It's much more simple than that. You don't need to do basal body temperature charting. All that does is take a person with a 1% per month chance. They wait 6 months, and then they find, yeah, they didn't get pregnant over those 6 months, and it didn't change anything that we do. The other thing, though, in getting back to the myth, I've seen couples come in and they say, okay, this is where the temperature rises, and this is exactly when we're having sex. Well, the temperature rises after ovulation. So when a couple comes in and points that out, it is saying this is exactly when it is too late to get pregnant that they were timing things. And you feel really bad for them that they've heard this myth and have been doing things wrong. But fortunately, that's also, if that's the reason they aren't getting pregnant, that's at least a very easy fix for things. Hey, Michelle. Hey, Brianne. Next thing is cough syrup helping you get pregnant. I see people talk about Robitussin and all these crazy things that they have to drink in order to become more fertile. Geritol is another one that goes in there. So here's the thing. They've done trials. It does not help you get pregnant. Moreover, for Robitussin, actually, if you take the Robitussin D, which is the decongestant, it actually dries you out and thickens the cervical mucus, which can actually make you less fertile. So you shouldn't be thinking you need to do Robitussin or any of these, old wives' tales for sort of how to get pregnant. They really don't work. Similarly, 2 double-strength aspirin. A lot of people are talking about whether aspirin will help them. Here's where things, and the philosophy is if you thin the blood, more blood flow goes to the ovaries, you might get an extra egg. Here's where that data really comes from, and I'm speaking from my own experience. When I went through residency, I was looking at studies for research and finding, you know what, if people took aspirin, they were more likely to get 1 extra egg at IVF. Now, and that's very different from just the person who is trying to get pregnant spontaneously or taking a little letrozole or Clomid or something else like that. Here's why that doesn't work for most people. You want an extra egg to help you get pregnant? Take a little more letrozole or Clomid. Go up on the dose, but you don't need aspirin for it. Now with IVF, I was thinking, well, with IVF, let's say you've maxed out on your dose, could you end up getting a little bit better of a yield with some aspirin? And potentially you could, although usually what you do is just go for a slightly higher dose. Here's the thing. What happens with the aspirin is if you're doing an egg retrieval, people often start bleeding into the ovary and they get these massive ovaries, and you think IVF can be uncomfortable after just a regular thing. Again, you're uncomfortable or bloated from 1 egg in a month, try 20, that takes a toll. But if you are taking aspirin and then all of the places you ovulate from now become, think of hematomas where you've got a bruise under your arm, imagine 20 of those because you bled into the ovaries. That's miserable for people. So the thing is, you aren't really changing pregnancy rates, but you are making people really, really uncomfortable. So aspirin you should stay away from. Hey, Amanda. Marty, okay, pineapple core. I am going to definitely do the, whoops, wait a minute. Comment I was about to respond to was the pineapple, and let's just try that again. Hey, Mahaley, but I'm going to definitely talk about pineapple core. Pineapple is one of the silliest ones. I hear everyone talk about, oh my gosh, I have to eat pineapple. That'll make me pregnant. Here's the thing. If pineapple worked, the Hawaiians would have taken over the world. Like, they would have just outpopulated us all from all the pineapple they're exposed to. Maybe the islands, they would have been constrained by it. But the point is, again, pineapple doesn't work. Another one, like people talk about having meat or fish or something to determine the gender of the child. Remember that the gender of a child is determined by the sperm. And so it comes from the guy. So the woman, because again, the woman can only give an X chromosome, the guy can give an X or a Y chromosome. So there's nothing the woman eats that will determine the gender of the child. And even the guy can't really change his sperm to make it more X or Y. That's a whole nother story. But the point is also then after pregnancy occurs, the genders are determined from the moment of fertilization. And so if you are trying to do things for pills or foods or other beverages. I've heard people talk about hot tea or cold tea being more likely to affect gender. Again, that's determined by DNA in the egg. There is no pill you will take that will change the inherent DNA of an egg and a sperm. So that definitely doesn't have an effect on things. And by the way, hey, Candace, all of you guys throw in favorite myths. And if you want, I'll go on tangents and I'll talk about, I have my whole list of 50, but if you want to hear about one particular one or anything else, I am happy to bring it up. Another myth I get about for regular conception is to wait 3 months after stopping the birth control pill. Now, here's where that really comes from. Depo-Provera, that's the shot for many people for getting pregnant. Yeah, that lasts a long time in the body, and it can take 3 months to wear off for that. And in fact, you can see people even taking a year to a year and a half before they're fully back to their normal fertility, depending on how long they've taken Depo-Provera and if it's accumulated in their body. However, for most people, it's the pill actually synchronizes the eggs, and the month you come off the birth control pill, you have a slightly higher chance of twins. So I don't think it's going to be slowing people down. Conversely, there are a lot of people with PCOS, and they say, hey, you know what? If I go on the birth control pill when I come off, I'm a little more likely to be pregnant. And there's a little bit of truth to that, because what happens is you get rid of all the male hormones, or you lower them. That causes the inertia with PCOS. And then if you end up with having irregular cycles from the high male hormones, you get rid of it through the birth control pill, you're more likely to ovulate when you come off. However, that's kind of inefficient. It's sort of like saying you want to get to your destination normally by walking, but you decide to put on roller skates. Just take a car. Just get the medications like letrozole that are more effective in getting people to ovulate. So anyway, that's another one. This is a broader thing. Again, I always talk about fringe therapies. You can find a paper that will advocate anything. I remember seeing a paper once. I've had people come in and say, hey, there was a 65-year-old woman that took this herb in China and she got pregnant. I'm pretty skeptical of that. You can find a case report where someone got someone's birth date wrong or all these other things and they didn't tell the true story. But you can even find papers on many topics. One of the best I saw was one on medical clowning. And they took this group of randomizing people to IVF versus not. And they basically gave them a 15-minute stand-up routine from a clown. And the people who had the clown therapy were more likely to get pregnant by about 40-50% than the people who didn't have clown therapy after their embryo transfer. Don't let bozos run your life. They've never been able to repeat this study. Laughter may be the best medicine in some ways, but I do not see it as meaningfully likely to improve your chances of pregnancy for things. So don't. Hey,
about proceed or conceive plus.
So, okay. So that's a really good question. So here's the thing for precede and conceive plus and things like that. I'll take a myth and then talk about what these two lubricants do well, and then talk about alternatives. So there's a myth on the internet that lubricants make the sperm more slippery and help the sperm get where they need to be. The reality is that most lubricants are actually spermicidal. They just kill the sperm's motility, and you just see it instantly plummet, and the sperm can't move very well. So if you are killing the sperm, again, it's always awkward when you have a couple come in and you find they've been using a spermicidal lubricant for 2 years as the reason for their infertility. So if you can avoid spermicidal lubricants, that's good. Precede and Conceive Plus also work very well as a non-spermicidal lubricant. What you also see, though, is an interesting study was that showed that actually canola oil and olive oil work just as well as these commercial lubricants. So I've joked with people, you go to the kitchen, you make a salad, you make a baby, have some fun. The reality is, though, probably shouldn't do that. Sometimes these oils can lead to infections and things like that. But the point being that actually, rather than $5 for a single use, if you get it by a quart for $5, it's a little more economical. But again, don't get any vaginal infections. Anyway, yes, Pre-Seed and Conceive Plus do actually work for things. Hey, Brittany, good to see you. The next thing beyond, so anyway, don't do anything crazy with medical clowning or all those other things. Next thing, for sort of more of a general health myth that people talk about, is they say when it comes to weight, only too much is bad. And I actually see people who are underweight. But here's the interesting thing. Weight is not usually the driving force for some fertility. For most people, it accounts for less than 5% of their actual fertility. This is a gap between what the research shows and what is clinically meaningful. You can have something that's statistically significant, where you can show there's a difference between the two groups. But the thing is, you get a large enough size for anything, and you can show a difference. The question is more, Cynthia, I think there's someone, if you could get that for things, all good? Well, for things, they just moving the camera. I think someone's arriving early for a second for a consult. We'll be talking with them a second. Just putting one thing on pause for a moment here. But anyway, we regain my composure as I get distracted for a moment here for things. Hey, Lindsay, how are you? The point from it, though, is weight is often a minimal factor in whether or not a person gets pregnant. Again, 5%. You want to be well. Now, again, if you have an extreme of weight where you don't ovulate, it's kind of hard to get pregnant if you're not releasing an egg. But for most people, that's really not the force that determines things. Most people again, we had really low weight when we were chasing gazelles around the savannah in Africa, or, you'll go to McDonald's and you see all these people eating horribly. They're surrounded by a litter of kids. It's not their diet that makes or breaks them. So that's also something that they should keep in mind. The next thing is 40 is the new 30, and that's true for reproduction as well. Or 50 is the new 40, honestly, as I'm going to turn 50 next year. I've been saying, I'm not sure if 40 is the new 30, but as I get older, I'm realizing that 9 p.m. is now the new midnight for me, at least for things. Time is ticking on. But anyway, here's the thing. There are a lot of things where we're able to be more well and healthy and postpone some of the costs and tolls of health on our lives, where we're healthier for longer. However, for the eggs, their biologic clock is on their own, and you can't put them on pause. It's not as though you can take birth control pills or Lupron as a shot or other things, and then all of a sudden have menopause in your 70s. And you ovulate your best eggs first. So don't think that if you were to postpone fertility to 45, that'll be the new 35, and then it's all the same. So many of these celebrities that are having kids, it's that they say, yes, this is my child. It is their child. And they say, yes, I use my own eggs. But the thing is, many of them, that doesn't make biologic sense to me. And you see all these celebrities getting pregnant after 45, when normally the IVF success rate is around 1%. When Cheryl Teague said that she used her own eggs to conceive, I think at 51, that doesn't make biologic sense to me, because from the reports I've seen, I'm not aware of anyone using IVF to get anyone pregnant with their own eggs after 47. That's a record, and usually it's in the 1% range for around that. So if Cheryl Teague's used her own eggs at 51, the only way that makes sense to me is by her own eggs, she means she paid for them, and they were her property. But I'm not aware of any cases where someone successfully used eggs in a 51-year-old from that person. So time does march on for people. Hey, Betsy, if you don't ovulate, do the chance of conception remain the same? So yes and no. Great question on that. So here's the thing. If you aren't ovulating and not releasing an egg, it's really low chances. You got to have that egg to get pregnant. However, here's the flip side. If the reason you aren't getting pregnant is that you're not ovulating, and then you get medication and you do ovulate, your chances go through the roof. So if you look at a 35-year-old who's been trying for the first month she has about a 30% chance of getting pregnant. If she has been trying for a year, it's 2%. But the person who's been trying for a year and never ovulated in that year and then ovulates that very first month, that's where she's at that 30%, arguably. So again, it really matters how many times people have tried to get pregnant in order to predict their chances. There's a huge difference between the person trying for years with opportunity and the person who has been wanting to and had sex, but they never had an egg before. So that's where that difference comes. I hope that makes sense. But again, I would say if you go from 0 eggs to 1, your chances are better than the person who's going from 1 to 2 for things. Another myth people often ask me about is okay, I had a child. Why isn't the next time going to be easy? Or, the myth is, you've had a baby, having a second child will be easier. That is not always the case. And I think that, I would even give credit or support to those who are going through secondary infertility, because sometimes that's even lonelier than those who've gone through regular infertility. And the reason is, the people who don't get infertility, in fact, most people don't. There was a list of healthcare problems in the UK, and at one point they put, out of 715 problems roughly, they put infertility as the 704th as their priority. We were behind tattoo removal in terms of what mattered to the British in that study. Now, that was a while ago, but the point is, people without infertility don't often get it for what's important. And so what the thing is for secondary infertility is that people who've had a kid, the people with infertility say, well, you have a kid, you should be grateful. And the people who don't have infertility don't get it. So it's its own different kind of thing. I would say the thing is that having another child isn't always easier. And the reason is some things can happen. You could have had a complicated delivery, which scars the uterus or scars the tubes from a cesarean section. Usually that doesn't happen, but that can. You gain weight after a delivery, and that can make people more medication resistant to when getting letrozole or other things. Or you can have it so you've gotten older. And I've seen couples where, again, they've had the first child, they come back 5 years later. Well, there's a huge difference between going from 33 to 38 in terms of the chances. So actually, just because the people who've had one before, at least you've proven it's potentially possible. But at the same time, just because you've had one before doesn't necessarily mean that it's going to be easier. Okay, jumping onto notes to remind myself of all these myths that are going to do. And again, throw out ones that you want me to talk about for things. Hey, Shelly, good to see you. In terms of the next one, okay, this is one that I've heard that is silly. Intercourse or orgasm can trigger ovulation. And so, people are talking about, if it's good for the woman, it's going to be good for having a baby. I wish that were the case. In fact, actually, that works in rabbits. You will find that rabbits actually are facultative ovulators, and so when they have relations, they drop a lot of eggs all at the same time. However, humans, we aren't entirely like rabbits, to say the least. And so there's a little bit of truth to this myth, by the way. They actually showed that they had these women where they broke them into 2 categories. And one, they just had relations randomly whenever they felt like it. And the other were the weekend warriors, for lack of a better term. And they tended to not have sex during the weekday, but would on the weekends. And what you found was the women who had sex on the weekends, mostly, they, instead of ovulating during for the normal percentage, instead of 30% chance of ovulating by normal statistics, it was closer to 35%. So it went up a little bit, but it's very subtle. And so the way to look at it better is to say, hey, if you're wanting to time things, just have sex twice a week. Sperm lives 72 hours. So if you have it Wednesday, Saturday, you're mostly covered for when you're going to ovulate. That's much simpler. But yes, orgasm unfortunately does not trigger ovulation, or fortunately. Hey, Whitley. Endometriosis. Okay, endometriosis. So endometriosis is very important. By the way, just to talk about a broader concept on this, we're coordinating the endometriosis march for Mississippi. We are likely going to be having it, it's supposed to be March 28th of 2020, and we will likely have it at the university, but we're still going through the negotiations for that. But we are going to be bringing endometriosis patients, we're going to be bringing together clinicians, residents, physicians, all kinds of people who care about women with endometriosis or personally have it, and just promote broader awareness for this very difficult disease. So I didn't have a endometriosis myth prepared, but I can come up with a very quick one, which is that endometriosis is all alike. Not even close. Endometriosis often has multiple different causes, and there are multiple ways of looking at it. So first of all, you have to say what can cause it. And some people have it because they just have very heavy periods. So they're bleeding, there's so much blood, it goes back through the tubes into the pelvis, overwhelms the body's ability to clear it. Next reason for endometriosis is that the things can't get out. So if you have a frozen cervix, or you have a otherwise scarred or closed off cervix, and the blood can't get out, endometriosis can get worse because it just is going more back through the tubes by not being able to go through the cervix. In fact, this is why women who've had endometriosis and they have a C-section don't do as well as women who've had a vaginal delivery. Because if you have a vaginal delivery, you open up the cervix a bit. Actually, for having been pregnant, that works better for endometriosis. So that's also a factor for things. Another thing is just also people with immunologic dysfunction. The body just isn't efficiently clearing or working on things. That can also be important for endometriosis. For treating it, there are all kinds of things, and I would say the core is trying to stop having periods. So if you have periods only 4 times a year instead of 12, that will reduce it, and then there are medications and other things. I think another myth is that everyone has to have surgery for endometriosis. And I would say, actually, we had a panel and a group debating this last year at our national conference, and the consensus was that actually you have to do the right thing for the right person, but the cost of surgery relative to risk may not be worth it, particularly in low-stage disease for things. But again, that's for debate. I'll talk about that another time for things. Next myth, getting back to sort of things on ovulation, just like, ovulating with orgasm. Next myth is you're supposed to have sex as many times as possible on the day that you are ovulating. I've actually had couples try to do this. If you maximize the DNA in the reproductive tract, you're more likely to get pregnant. I've had couples come in sore, both of them barely able to walk from just trying to put as much sperm there as possible. It doesn't work that way. There was a great study by Wilcox, New England Journal of Medicine, from about 20 plus years ago, and he showed that actually if you had, again, 0 acts of sex, the study was underpowered to detect divine intervention once every 2,000 years. But if you had 1, 2, 3, 4, or 5 acts of sex, there was no difference in the pregnancy rate. And so the way I go back to this is, again, if sperm lasts 72 hours and you only need it once to really get to as much of a difference as it makes, have sex twice a week. That keeps it simple. Again, if you feel like doing more, go for it. That's your own business, everything like that, but you don't have to put pressure on yourself or have it daily around ovulation or all that crazy stuff that many people talk about. Just seeing for the next things, are there certain stages, from Jessica, hi Jessica, stages of PCOS that determine whether or not you can get pregnant? First of all, it's interesting. A lot of people with PCOS, it's not their PCOS that keeps them from getting pregnant. PCOS is on a spectrum. I used to say shades of gray, but that kind of means something different these days. But you can have people who are a little bit irregular for their cycles, and there are the people who are very irregular. If 80% of women get pregnant in 3 months, and so a lot of women will be pregnant 4 times in a given year. Let's say you have cycles that are every 40 days instead of every 30 days. That means you should have been pregnant 3 times in a year instead of 4 times. It's not the PCOS. Now, again, if you don't ovulate at all, that's more severe and concerning. And so I would say that's something I pay attention to for PCOS. how resistant are they to medication. But I see a lot of people with slightly irregularity, and you call it oligoovulatory infertility, but I would say they're superimposed unexplained infertility. It's not their PCOS that's driving things. And so that's something that really a lot of people miss. Another question here from Ms. McGee. If a woman never had period but went through fertility and conceived, why was she unable to have a regular period after birth? So, first of all, the answer that's always right in medicine is it depends. You can have all kinds of reasons for things. First, I would say that if you are almost never ovulating, and then there happen to be sperm there the one time an egg is released, and I've seen that happen, the reason for you not ovulating in the first place or being very, very irregular for it, that won't have necessarily changed by the time that you've had a baby. Again, just because ovulation isn't just about the ovary, there's a lot that interplays from the brain, the adrenals, fat, all that. Similarly, menstruation isn't just about the uterus, and there's a lot of interplay from other sources. So there are a lot of people who can have these types of things go on. Let's do just a few more, and I didn't even come close to all the things that I was going to go over today. Sperm live for 6 hours? No, it's closer to 72, and they can even go for 5 to 7 days. But for, again, 72 hours is sort of the typical data. Now, here's one thing that can surprise people. When they've had cervical surgery, it can actually drop. If you lose parts of the cervix, which help keep the sperm alive, then the lifespan goes down for things. Another myth is that fertilization occurs in the uterus. There are a lot of people who think that, and actually no, the fertilization occurs in the tube. And if you have a bad tube or a dysfunctional tube, that's why people get ectopics. Sperm and egg may have a hard time finding each other from tubal damage, and when they've taken that damage, the embryo can't make its way back to the uterus. And then the final thing, you must lie down or have your hips elevated for 2 hours after intercourse, intrauterine insemination, or an embryo transfer. They've done the studies for this, and they show there's no difference between waiting for 10 minutes and 2 hours. Now, some people are saying even there's no difference from immediately getting up and going and 10 minutes. And so I tend to be on the overly cautious and have people lie back for a little bit, but I think that you could even make the argument from some data that you're good to go the moment things happen. The reason I emphasize that is just all these people are thinking, oh my gosh, I have to have the legs up on the dash of my car as I drive home and all this crazy stuff. By the way, don't ever do that, especially if you're the driver. The police get very upset when they see the legs on either side of the steering wheel. But I would say that ultimately, this is something that's really good data that once the sperm and egg get where they need to be, people are in very good shape. I think that's all I've got for time for today. There are many more I wanted to go through. I have a lot of fun stuff. I mean, I have like you can't get pregnant during your period. If your period is regular, you're fertile. Infertility. Oh, a lot of male stuff. The boxers versus briefs myths. The lubricants. Virile men have normal sperm counts. More likely to get pregnant after you adopt. The heart rate determines gender. Oh, all kinds of psychological stuff, economic stuff. I've got a lot of things. I think I know what I'm doing for November. So, okay. Thank you guys for tuning in. We're going to have a lot more fun with the next one. And ask us your questions. Let us know whom we can help. And remember, don't go it alone. There's so much that can be fixed. Support those who are not yet on the other side of the journey, for those that you've been successful. And again, thank you, and have a wonderful and awesome Columbus Day a week from now, and Halloween after. And I look forward to seeing you guys in a month. Bye.